So this is the convergence, same different direction, and this is the divergence, moving in the opposite direction. They are divergent here, divergence, convergence this way. And in ocular motility, we have to also focus on the muscles which are involved in that particular motility. So this is the easy diagram to actually remember the movements. So it is superior rectus, inferior rectus, medial rectus, lateral rectus, and inferior oblique, superior oblique. Oblique muscles are, see, I put them in a different way. It is above, it is actually this above, right? But here comes the inferior oblique and here comes the superior oblique. So this is the directions annotation, that is upside down, up, down, and medial, lateral. So it is medial, it is adduction, lateral, it is abduction, and superior oblique, see, it is adduction, elevation, and it is moving this way, means it is inward movement, so it is intorsion. And see here, superior oblique, it is abduction, right, and it is depression. And see here, superior rectus this way, and superior oblique also this way. So they are not a different, arrow marks are maybe indicated in a different way, but as we see in a rotation wise, they are the same. So it is intorsion. Intorsion is nothing but the encycloduction here, right? Yeah. And inferior oblique, it is elevation, and it is again abduction, and it is extorsion, moving this way. And here inferior rectus, that is here is the here it is adduction, and it is depression, and it is, see, this inferior oblique moving this way, and the inferior rectus also continues the same directions. Maybe the arrow marks are different, but overall or rotation wise they are the same. So it is extorsion. So it can be inferior rectus or inferior oblique. So focus on inferior. When you look at the inferior muscles, inferior oblique and inferior rectus, so rotational wise direction is extorsion, right? And when you look at the superior, rotation wise can be superior oblique, can be superior rectus, but rotation wise it is intorsion. So when you encounter superior, we have oblique and rectus over here. It is superior, that is intorsion. If you encounter inferior, we have got oblique and rectus, can be inferior oblique, can be inferior rectus, but both are helpful in extorsion. So listen here, it is inferior, intorsion, no, it is different, it's not like that. It is if it is inferior, then extorsion. If it is superior, it is intorsion. And one more thing is that if you look at the lateral rectus and medial rectus, the arrangement of these two muscles are in lie parallel to the optical axis. That's the reason why they got only one particular movement. But superior rectus and inferior rectus, they are not parallel with the optical axis. They make an angle of 23 degrees with the optical axis. And superior oblique and inferior oblique, they make an angle of 51 degrees. They are arranged at an angle of 51 degrees with the optical axis. So what is optical axis? See, it is the eye, and this is the cornea, right? And here we have the pupil, and here is the fovea. So this is the optical axis. So the here presents the superior insertion of the superior rectus, and beneath this we have inferior rectus. So it is making an angle of 23 degrees. And if you look at the superior oblique comes this way from the optical foramina. This goes like this, and here it crosses the pulley, that is trochlea, and then get inserted over here like this way it gets inserted. So it is making an angle of 51 degrees. Hence these set of muscles making an angle of some degree of extent to that particular optical axis, they are involved in multiple movements. See here, elevation, adduction, intorsion, depression, extorsion. This is the reason why superior rectus, inferior rectus, and inferior oblique, superior oblique are involved in multiple directions, whereas the lateral rectus and the medial rectus are involved in only one particular direction.